Hello everybody, thank you very much for joining us. I'm joined here today by the Economy Secretary Fiona Hyslop and our National Clinical Director Jason Leitch. Let me give you the usual update on the COVID-19 statistics. An additional 27 positive cases were confirmed yesterday, which takes the total now in Scotland to 18,104. A total of 904 patients are currently in hospital with the virus, either confirmed or suspected, and that is 25 fewer than yesterday, and it includes a reduction of 19 in the number of confirmed cases. A total of 19 people last night were in intensive care with confirmed or suspected COVID-19, and that is 4 fewer than yesterday. Since the 5th of March, a total of 3,961 patients who had tested positive and been admitted to hospital have now been discharged from hospital. However, in the past 24 hours, 6 deaths were registered of patients confirmed through tests as having had COVID-19, and that takes the total number of deaths in Scotland under that measurement to 2,470. And my deepest condolences go to the families behind these statistics, and indeed to everyone who is grieving a loved one because of this illness. And my thanks go to everyone across our health and care services who continue to care for those affected by the virus. Now, yesterday in the Scottish Parliament, I confirmed that we would move into phase 2 of our exit from lockdown, which is good and positive news. And that was made possible by the significant progress that we have all made over these past 3 months. So I want today, again, to thank everybody across the country for that. The virus, of course, hasn't gone away. That's something we need to continue to keep in our minds. But there's no doubt the virus in Scotland is now firmly in retreat. And that's why the changes to the rules and the guidance that I announced yesterday, though significant, we're also careful because we know we have to keep the virus in retreat. And we have today published some of the supporting evidence which informed the decisions that we took and confirmed yesterday. Now, I'm not going to repeat everything I said in Parliament yesterday, but I do want to take the opportunity to quickly recap on some of the main changes. The Cabinet Secretary will talk in a moment about the measures that directly affect business and the reopening of the economy. And on Monday, we will receive the report of our National Advisory Group on economic recovery, and the chair of that group, Benny Higgins, will join me here on Monday to talk through its recommendations. But for my part today, I want to focus on the changes relating to social interaction and leisure. And ahead of the weekend, just remind you of what the new rules are for staying safe. And that, of course, is what we are now asking you to prioritise. You will see on the lectern in front of me that stay home has been replaced with stay safe. And now we are asking you to focus on staying safe, protecting others and saving lives. And as we all start to go out and about a bit more, we do therefore need people to pay more attention to the basic steps that all of us have to take in order to stay safe. Now, as a recap from today, you can meet up with up to 2 other households outdoors rather than just one other household, which was the case before today. However, it should be no more than 2 at a time and no more than 2 in a day. And we are still advising that you should keep the total number in any one group to a maximum of 8. We judge right now that the risk of mixed household gatherings inside is still too great and would offer too many opportunities for the virus to start to spread again. So these meetings should still take place outdoors. However, if you're meeting in the garden of another household, we have changed the guidance so that you can now go indoors to use a toilet. If you do that, of course, you should avoid touching surfaces and immediately and thoroughly make sure you clean any surfaces that you do touch. That, again, is really essential in staying safe and protecting others, because by doing that, you are preventing the spread of the virus from one household to another. We are continuing for the moment to ask people to stay within or close to their local area. That means for leisure and recreation purposes, you should be travelling no more than around 5 miles. But let me stress that limit does not apply to meeting up with family and friends. These are some of the more general measures which apply from today, but I wanted to highlight two sets of changes we've made for specific groups. The first relates to people who are shielding. The guidance for those individuals remains different to the guidance to the general population, and we are of course continuing to advise shielding people to be very cautious, because you are the people who are most at risk from this virus. However, we've also announced some careful changes which we hope will improve your quality of life. We said that unless you live in a nursing or residential care home, you're now able to go outdoors for exercise, for a walk or a cycle, for example. You can also now take part in non-contact outdoor activities such as golf, and you can meet outdoors with people from one other household, but in groups of no more than 8. You should, though, stay at least 2 metres away from other people at all times, even if you live with the person that you're out with. And don't go inside somebody else's house, and don't allow someone else to come into your house, even to use the toilet. And when you do go outdoors, see if you can choose times of the day or areas that are a bit quieter, and that is all for your own safety. But I hope these changes do help to make things better for you, because this lockdown, while it's been difficult for everyone, we know has been particularly hard for those in the shielding category. The other set of changes I want to briefly highlight are those for people who either live alone or live alone with children under the age of 18. From today, people in those circumstances are able to form what we have called an extended household group with one other household. Within that extended household group, people will be able to meet indoors without physical distancing, and if you want to, you'll be able to stay overnight at each other's houses. However, you must, if you're in one of these extended household groups, still meet any other household outdoors only and stay 2 metres apart from them. And there are some other conditions which are necessary to make sure that this change can work without significantly increasing the risk of the virus passing from one household to another. So an extended household mustn't include anyone who is shielding, because the risks to the shielding population are still too high. No one who is in one of these extended household groups should form a similar arrangement with any other household. And if one member of the extended group gets the virus, all of you will have to isolate, whether or not you're living in the same house. So within these conditions, this, though, is a positive change that I hope helps to deal with some of the loneliness and isolation that has been a really cruel feature of the past few weeks. It won't benefit everyone, this change right now, but it will benefit a significant number. For example, it will allow a grandparent who lives on their own to form a group with another household in their family and see grandchildren, and I'm sure many are taking advantage of this already. It will allow a single parent and their children to join with another household for support, and of course it will allow a non-cohabiting couple, if one of them lives alone, to be reunited indoors without the need for physical distancing. I hope very much that we might be able to extend this extended household group idea in the not too distant future, so that it benefits more people, and I will keep you updated on that. All of the changes that I've just outlined are of course now in effect, and if you need more information on them, because as we ease lockdown things get more complicated, so if you want more information on the detail, please go to the Scottish Government's website, where you will find the guidance and the explanations of what we deem it is safe now to do and what we are still advising you that it is not safe to do. As I said yesterday, it's not possible with the best will in the world for us to provide specific guidance for every single individual circumstances. So my advice to you is to continue to err on the side of caution. If you're in any doubt about something, if you think that something you're considering doing might give the virus the chance to spread, then the best thing to do is err on the side of caution and don't do it. Now, one of the consequences of easing restrictions, as I've just said, is that things inevitably become more complex. So while we still, of course, want you to stay at home as much as possible, and certainly more than in normal times, we know that the message we're giving to you needs to adapt, which is why, as I said a moment ago, we're now asking you to stay safe, protect others and save lives. But that means it's more important now, even more important than it's been in the last few weeks, for all of us to know and to remember the different things that we need to do to stay safe. So we're launching a new public awareness campaign called Facts. And each letter of that word facts should serve to remind us all of the key measures that we need to comply with. So let me quickly run through them. Face coverings in enclosed spaces, avoid crowded places, clean your hands and surfaces regularly, 2-metre distancing, and self-isolate and book a test if you have symptoms. So remember these facts, and that will help all of us stay safe, and it will ensure that all of us can help protect each other as well. And complying with all of that in this next phase is going to be really critical in making sure that we keep this virus under control as we start to move back to normal. And that will be important now, but it will also be important in laying the groundwork and the foundation for the further changes that we hope to make in the weeks to come. I want to end just with this point. I am very aware that this next phase, in some ways, and this may be an odd thing to say given how hard the last few months have been, but in some ways this next phase might be even harder because we see the virus receding. So I think all of us have a very obvious and human and understandable frustration about still having to live under some restrictions, and we think, why can't we go back to normal even more quickly? But the thing is, we can't afford at this stage to be complacent because the virus is still out there, it hasn't gone away. And as we gradually remove the restrictions that have kept it under control, the risk is it starts to circulate again. That's why we need to proceed with purpose. I want to keep us going firmly in the right direction, but also with a bit of caution. And it also means that all of us have to continue to play our part in suppressing the virus. And more than ever in these days and weeks to come, the things we do as individuals will have an impact on all of us, and they will determine whether we keep this virus under control or go backwards again. So if we all keep doing the right thing, I am more optimistic than I've been in a long time that we are now firmly on the track to getting normality back into our lives. And that is all down to your sacrifices and your efforts. So thank you again very much indeed. I'm going to hand over now to the Economy Secretary, who will recap on some of the measures as they affect business, and then Jason will say a few words before we go to questions.
Thank you, First Minister. The latest economic indicators have deteriorated since lockdown measures were introduced. Scotland's GDP fell 18.9% in April, and the fall in the UK was 20.4%. In Scotland, output was down in nearly every sector of the economy. PMI business surveys have reported record falls in business activity, and there has been a sharp rise in the claimant count. This is no ordinary economic downturn. Many productive, profitable and sustainable firms have had to temporarily close, bringing immediate financial crisis. However, since the start of this crisis, the Scottish Government has been working tirelessly to keep businesses afloat and ensure as many people as possible keep their jobs, and we will continue to do that. So far, this has included a tailored package of more than £2.3 billion in business support. Earlier this week, we also announced a £230 million return to work, shovel-ready capital and growth economic stimulus to stimulate Scotland's economy. We have also set up an independent advisory group on economic recovery led by Benny Higgins, which, as the First Minister has said, will advise next week on further actions needed to support recovery. As the First Minister set out to Parliament yesterday, the gradual reopening is only possible because the general public and our businesses have adhered to the public health advice required to protect lives. As we move into phase 2, it is important as ever that we continue to follow health advice and that businesses continue to adhere to the business and physical distance regulations, that they ensure the safety of their staff and customers, and that they apply fair work principles and a flexible approach to dealing with the impacts of COVID-19 on workers to protect them from financial hardship. To give confidence to both staff and customers, we'll continue to publish sectoral guidance which will be developed in close consultation with business organisations, trade unions and regulators. And I want to say a little bit more today about a few sectors that will see further guidance this afternoon. I set out yesterday. From Monday the 29th, retailers with outdoor entrances and exits will be allowed to reopen. This is welcome news for Scotland's economy, as it means that the majority of shops will be able to reopen. Between now and the 29th of June, local authorities and retailers should be ensuring that plans for the use of public space are in place. And I also can confirm today that the remainder of manufacturing can also restart from the 29th of June. I must stress that this is subject to the comprehensive and collaborative risk assessment approach emphasised in the guidance. Manufacturing is a key sector of our economy, employing over 180,000 people prior to the crisis, and less than 5% of those staff can work from home, so this is a welcome move. I also want to take this opportunity to recognise that many of Scotland's manufacturers and their workforces have been involved in supporting essential sectors throughout this COVID-19 crisis. In doing so, they have demonstrated the sector's innovation, skills and expertise, so thank you. I want to finish today by saying that the Scottish Government will continue to work tirelessly to ensure that the gradual reopening of our businesses will happen, and we continue to use every lever at our disposal to ensure that we can rebuild our economy.
Thank you, First Minister. Just before I came down, I looked at the global numbers for this pandemic, and on hopeful days like today, I find myself hopeful, but I also find myself still concerned and worried. Just to put this in perspective, there are 8.5 million people globally who have had this virus. Over 500,000 people have died. To compare that with other public health challenges, Ebola in 2016 infected 30,000 people globally, and we have 8.5 million with this virus. That is why the move out of lockdown is so important and has to be so careful. The numbers, as the First Minister has just described, are hopeful and good for Scotland, but we must not underestimate this virus. There are still 55,000 people globally in intensive care units. One of the crucial parts of remobilisation, apart from business and retail and everything else, is the remobilisation of our National Health Service. Health boards have begun that remobilisation of their paused services and look to see and treat as many patients as fast and as safely as they can. I want to send a message to those of you who have had appointments sent to you, those of you who are waiting. I would ask you, and this may seem like an odd request, I ask that you attend. I ask that you go to your appointment. And I realise some of you will be concerned about that, about safety and risk. I'd like to assure you that the health boards are ready. They have put in place all of the appropriate health, safety and social distancing measures that they require to keep you and the staff safe. They would not ask you to attend if they did not feel it was safe to do so. The NHS is open and has been open, but it is opening more over the next days and weeks. I would encourage anyone that is worried about an existing or new health condition to contact their community pharmacy, their GP or NHS 24 out of hours. Over the next few weeks, we will start to see aspects of life start up again, but we must remember that these tentative steps are only possible because of the downward trend, and they will only progress if we continue to see a drop in cases. The virus is still here, and the rates are only falling because of what each of you has done. So as we go into this weekend, Father's Day awaits. Please remember that it's up to all of us to choose to keep doing the right thing to keep yourselves and your loved ones safe. If you are meeting with 3 households, please consider, is this the right thing to do? Don't look for ways to push the boundaries. Look for ways to stay within the boundaries. If you're heading out to take exercise, perhaps ask if that could be more local than you had planned. Keep away from busy areas and keep 2 metres apart. Constant vigilance is the only way we can keep this virus under control and progress through the route map. Thank you.
Thanks very much, Jason. I'll move now to questions. Gordon Cree from STV.
Thank you. Can I ask both yourself and Jason Leitch that up until now, for the general population, the rules have largely been the same for everyone. Now we have these extended household groups which come with caveats and qualifications. To what extent are you concerned that either through confusion or willful ignorance or simply people thinking the rules don't matter, we're going to see or are already seeing people pushing the limits or simply just doing as they please?
It's a very good question, Gordon. I think you can take from Jason's introductory remarks there that this is something that has always been a concern. We've made the progress that we have made because we've all stopped interacting with each other, and the vast majority of people have complied with the rules of lockdown. If that hadn't been the case, we would not be standing here today with this virus so firmly in retreat and getting, not quite there yet, but closer to the point of being eliminated in Scotland so that we can try to keep it under control through targeted measures. As we lift those restrictions and we all start to interact with each other more, then we provide more potential bridges for the virus to cross over and then start to spread out of control again. And that's why we are lifting these measures carefully, and we're being very, very clear to people the do's and don'ts. So yes, meet up outdoors with another household, or now up to 2 more households, but stay 2 metres apart, wash your hands, follow all these hygiene measures, because that keeps the risk minimised. But as we come out of a blanket lockdown, you know, for much of the last 3 months, my job has been to say to you, stay at home. And most of you have done it. My job now is a little bit more complex around the messaging, because I'm having to say, well, you don't have to stay at home all the time, but stay safe, and here's what you have to do to stay safe, and here are the things you shouldn't do. That's much more complicated, and therefore it brings more risk. But that's why I always stress 2 things. Go and look at the detail of the guidance so that you understand it. And when in doubt, don't do something. If I'd ask everybody to think, before you meet somebody, before you go somewhere, am I giving this virus a chance to jump from me to a person in another household? And what do I then need to do to stop that? Stay 2 metres distant. If you're in a shop or an enclosed space like public transport, wear the face covering, wash your hands thoroughly. These are all the safety measures that we need to take to reduce this risk. But there's no doubt this is, in some ways, a tougher phase we're going into, because we're all perhaps we're seeing the virus in retreat, so maybe we're not as much on our guard as we have been at a time when we're going out more, which means actually we need to be even more on our guard to stop it spreading. But I've got huge confidence that people want to do the right thing and are determined to do the right thing, because none of us want to go back to what we've been dealing with over the past 3 months.
Gordon, I get worried about transition days. Most people today, I think, are more hopeful, perhaps, and see that movement. But honestly, Gregor, the Chief Medical Officer, and Fiona, the Chief Nurse, and I, we get worried on transition points, because we're worried about the communication and how we get that across and whether we can make it understandable. I think we've done a good job of that collectively as a government, and I actually think, I shouldn't perhaps say this here, I think the media has in the main done a good job with getting that information across to the public. I think it's one of your tasks, as well as holding us accountable. The World Health Organization have 6 steps to coming out of lockdown, and the 6th step is engage and communicate with your population. They think it is as important as prevalence, as test and protect, as all the other elements. I think they're right. I think we have to make it understandable. And that goes from statements in the Parliament to TV adverts to interviews in the media. And I think we have to keep doing that to try and get people to be able to share with one another what the rules are and help the public understand there is reward if you follow these guidelines. I think that's the continued message we're going to have to give.
That facts campaign I spoke about earlier on, which Jason will be fronting on the television, whether you like it or not, remember that, the facts, each letter of that word tells you what it is we need you to do. So get that into your head and just remember that. And if we all follow these steps, then we will come out of this lockdown safely. And then we will be able to get more normality back. So this is the point where we all have that big, big part to play. Aileen Clark from BBC.
First Minister, probationary teachers who may be out of a job have written to the Education Secretary that they should be utilised, during this education crisis. Are there any plans to do that? And with one of your MSPs calling for more imagination to be used in the context of what's happening in Northern Ireland. What more can you tell us about your ambition for what should be happening in the education sector in the coming weeks? And for Jason Leitch, just to pick up on this issue of compliance, what is the latest official analysis of the level of compliance with the lockdown rules that you yourself have spent weeks and weeks, explaining as clearly as you can?
I'll hand over to Jason in a second. I've not seen the letter from the probationary teachers, but my view in general, and we obviously will reply to it in detail, is whether it's education or anything else right now, we need all of our resources, all of our talents, all of our skills to get the country through this. So we will want to utilise that in education just as we will anywhere else. On the issue of schools, we are working hard, led by the Deputy First Minister, but it's an issue of huge importance to me, to get our schools back to normal. And by normal, I don't just mean full time, but I mean with young people able to enjoy their school life without having to worry about, physical distancing and all of that. We want to get there as quickly as possible. The scientific advice we have right now says 2 metres distancing is required. So we're having to plan with councils how we can get schools back on that basis and how we maximise the time young people spend in schools. But as I've said in Parliament this week, we are also looking at what are the conditions to get schools back much more normally. And that involves getting levels of the virus really low, which they are well on their way to being. And then we perhaps have different options that don't require the same degree of physical distancing. So we're going through all of that right now. Some of it is contingent, as I say, on continuing to suppress the virus, but that's what we want to get to. And on the Northern Ireland point, we will, of course, be looking very carefully at the basis for the decisions they've taken and what we might be able to learn from that. I set out yesterday that we'd asked our own advisory group to look at the issue of 2 metres in a general sense, but clearly there are specific issues here from schools. But be in no doubt, I want to see young people back at school at normal and full-time just as quickly as it's possible to do. But underpinning all of this has to be safety. And I think every parent will agree with that. I was looking at some data from Public Health England this morning, and there's very few relatively young people back at school in England. Scottish schools will be back before the majority in England, but even with that limited attendance at schools, there were something like 24 outbreaks in schools in England last week. So we have to be careful and safe about this, but the objective is to get young people back to school as normal and full-time as quickly as we can. And the government with councils are working incredibly hard on making sure we create the conditions to do that.
Compliance in the main, Aileen, is good from what we can measure. We can't, of course, look in every household and every garden, but at the extreme end, the last time I spoke to the Assistant Chief Constable, the number of fixed penalty notices was stable or falling. There were some individual incidents that were very well publicised over the last couple of weeks. They worry us. They make me anxious when I see people in large gatherings, and we've been very clear that we don't want people to do that at this point in the pandemic, even if we have sympathy for some of those demonstrators and not clear for some of the others within those groups. The travel restrictions have worked. The buses and trains have had key workers in them. But we are moving into a period, as Ms Hyslop has just outlined, where we are opening more of the economy. So compliance will now look different. And that's why facts exist. That's why face coverings are important, cleaning surfaces are important. And I and others have had conversations with the bus companies, with ScotRail, with others about how we make that as safe as we can. And people will have to help us with that. That's not just about the industry and the owners of the businesses. It's also about the workers and the passengers and those who are going to use these to help us keep that compliance good.
Thanks, Jason. Brian Rutherford from Bauer.
Thank you, First Minister. Your Transport Secretary told Radio 4 that people will be fined for not wearing face coverings on public transport from Monday. How much will those fines be? And considering ScotRail staff won't enforce that rule, and your own National Clinical Director has previously said that masks in the general population don't work, I wonder, what is the point of this rule?
I don't have the regulations in front of me, so I will get you the information on what the scale of the actual fines are, because often these things go in a scale. But I don't want to focus here on enforcement of these things. You will have heard me say similar things in an earlier stage of this, which is around, yes, we've had rules in place all along that the police can and in some instances have enforced, but we have got where we are right now because people have done the right thing, and they've done the right thing for their own safety and for the safety of others. And that's what I want to focus on when I say to people, wear a face covering on public transport, because it protects others. And just again to explain how that works with face coverings. If you have the virus, but you might not know it because you don't have symptoms, if you have a face covering on when you're on a bus or a train with other people, you are reducing your risk of transmitting that virus to somebody else. And if you're on a bus or a train with somebody else who has the virus, if they're wearing a face covering, they are reducing the risk of passing it on to you. This is one of the simplest, and I know it's not comfortable for people, I know people don't like wearing face coverings, but it is one of the most basic things we can all do to protect each other. And remember, what we're asking you to do now, stay safe yourself, but protect others. And we'll all save lives. So that's what we're focusing on with face coverings. From Monday, mandatory on public transport, but also in other enclosed spaces, the strong advice is to wear them.
Can I respond to Matt?
Of course you can.
You say you don't want to focus on enforcement, but many members of the public do want you to focus on enforcement. They see many people not following the rules, and they are, and it seems a double standards here.
No, look, sure, rules will be enforced if they have to be enforced. When the Chief Constable has stood next to me here previously, what he said is the police have tried to go around about this in a very proportionate and sensitive way, focusing on explaining to people why they're being asked to do things and encouraging people to do things, and that's what we want to do. I think we get further with that if we explain to people why we're asking them to do things. And that's why I'm going to continue to say, yes, when we put something in law, of course it can be enforced, but let's all do it for the right reasons, which is we want to protect each other from a virus that we know can do so much damage. Jason.
So I've never said masks don't work. When I had a proper job, I was a surgeon. I wore a mask for 25 years when I was a surgeon. I also have always said that for the stage in the pandemic you are, and the stage crucially in the recovery you are, so as we open up, as things get more crowded, then face coverings are an extra layer of protection. It's very important they do not replace other elements. That's why, facts again, there are 5 elements in there. I got quite concerned when I saw some shops in England earlier in the week opening and lots of masked people crowded together waiting to go through the door. That's not how this should work. Face coverings are an important element if you can't physically distance in public transport, shops, etc. But they are one element of that, and they will help with risk in those environments.
Okay, Tom Eden from PA.
Good afternoon, First Minister. Thank you. You probably have seen the UK government has announced £1 billion of funding, further funding for education. I appreciate it's sort of early in the day, but I was wondering if you can guarantee that any Barnett consequentials from that will go towards education in Scotland. And just to follow up on the point made earlier about 2 metre distancing in schools, COSLA's education spokesman today has said that 2 metre distancing in schools will make it impossible for 100% of pupils to go back normally down the line. And I know you've talked about looking at reducing that. But how much notice will you give schools if your plans change?
Well, we work with councils and parent organisations and teacher unions through the Education Recovery Group. So these things will be discussed on an ongoing basis. I would like to get away from a situation where we have 2 metres distance in schools. I know there's debate about 2 metres in other settings as well, but in schools, not just because it would deal with the capacity issues. I don't want young people, if it's not necessary, to be having to go about their schooling and interact with each other in classrooms or in playgrounds, having to observe 2 metres distance. And I don't think that's what we would want for the quality of our young people's education and lives. So we don't want to have that if it can be avoided, but we have to be safe. School outbreaks are not something we can just dismiss as a risk. and therefore we have to both make sure young people are safe and persuade parents and teachers that schools are safe. And that's the process that we are going through right now. So if we can get away from 2 metres in schools, nobody, well, it's probably not the case that nobody will be happier than me, because I'm sure lots of kids and parents will be happy, but I would be delighted if we could have education without the need for young people to stay 2 metres apart from each other. On the first part of your question, we don't know yet whether there is any consequential funding coming from that announcement. I would certainly hope that there would be, and from early indications, I would expect there might be, but we don't have any confirmation of that, or at least we didn't when I came into this briefing. We were already working on options for supporting pupils to catch up with any missed education, and we'll set out plans around that in due course. We've already taken some additional steps to fund provision for vulnerable children over the summer, the hubs continuing over the summer, and I announced here earlier in the week the continuation of free school meals. So we're already doing a lot of that work, but yes, if there are consequentials coming from this, then we will want to make sure those consequentials go, every penny of them, to supporting education and supporting young people to catch up with the missed learning that they've had unavoidably over these past few months. Scott McNabb from the Scotsman.
Thank you, First Minister. You talked today about the virus being firmly in retreat in Scotland, and in Parliament yesterday I think the estimate was about 2,900 Scots being infected now. That's about 0.05% of the population. I'm wondering how low that has to get before you can say it's effectively been eradicated in the community. Are you looking at like a zero rate across all the indicators? And also, if I may, do you feel your previous scepticism about mobile phone app technology in the track and trace phase of combating the virus has been vindicated, given events down south yesterday? Will this technology have any kind of future role in test and protect?
Okay, thanks very much. On the first part of your question, I'm not putting a figure on it. That 2,900, which you're right to pick up on from yesterday, I would put a caveat on that it's an estimate. It's an estimate that comes from modelling, but it's nevertheless the modelling we've been using, and it is showing a very steady reduction in the numbers that we estimate are infectious at any given time. I haven't put a number on what we want that to get to, but we want to get it as low as possible. And the reason for that is that if you start lifting restrictions, then if you do that at the lowest possible level, then if you see any, as inevitably we will see outbreaks when we start to interact with each other again, but if you're having that happen from a very low starting point, you're able to deal with it in a much more targeted way. If you start to ease restrictions at a much higher point, or ease them too quickly at a higher point, then any growth in the virus would quickly take it out of control again. It's a bit like a, and I think it was the First Minister of Wales actually I heard using what I'm about to use just now. It's a bit like a fire. If you've got a fire and you've only got embers there, then if one flares up, you can just zap it very quickly. But if the fire starts to burn again, then you've got more danger of it running out of control. And if you then, in terms of easing restrictions, I suppose in that circumstance, put petrol on the fire, then it would run out of control quickly. So we need to get it to the lowest level possible to make it safe, to ease more restrictions, but also to ensure that as we do that, we can deal with any outbreaks on a much more targeted basis. Because if we have it going out of control again, the risk is we have to apply lockdown again more generally, and we don't want to do that. I really don't want to do that. So that's why we need to suppress it as far as possible and then deal with it if it flares up again in a much more targeted way. On your question about the app, we took a decision back, I can't remember exactly when, but a much earlier phase, that we would not build Test and Protect around an app. We would build it through the tried and tested way of contact tracing, the kind of way that experts do it with good old-fashioned shoe leather, using technology to help them facilitate that process, but that we wouldn't build it on the basis of a contact tracing proximity app that in our view wasn't tested and that the public didn't really know enough about. And I think that has been vindicated because the app that was meant to be launched, I think, weeks ago, hasn't materialised, and the UK government look as if they're now not going to continue with it. So I think I certainly feel relieved that we built the Test and Protect in a way that wasn't reliant on that app, because if we had made it reliant on that app, we'd be in a pretty sticky position right now. That is not to say that at some stage we wouldn't add something, a bit of technology like this, onto our Test and Protect system, because it may, help us do that. But our Test and Protect system is not dependent on that, and I think right now that's something we should be very grateful for. Was there? I can't remember if there was a part of that question to you. No. Tom Martin from the Daily Express.
Hi, good afternoon. Thank you, First Minister. Just on the going back on education, at committee this morning, COSLA Stephen McCabe made pretty clear that blended learning isn't a contingency plan, and saying, that it's the only thing that is going to go ahead in August as it stands. I just wondered, can you clarify, you mentioned in an earlier answer you were exploring different options, but from what he's saying, there doesn't seem to be any different options come August.
The different options which the government are looking at right now is how we would get to a position where we are able to bring schools back with a different set of criteria that don't involve the same degree of physical distancing. Now, we can't just magically move to that, because it's dependent on making sure the virus is at a low enough level, and we've thought through what other protections might be required. Now, that could be testing in schools, it could be certain aspects of enhanced hygiene in schools. It could be, as I believe Northern Ireland have just announced, that while physical distancing at 2 metres is not required for children, there is still 2 metres physical distancing required for teachers and between teachers and children. So these are things the government is considering right now. The work we've asked our advisory group to do on 2 metres versus 1 metre will have an impact there potentially, because we've asked them if there are particular issues around schools. And I want to see if we can get that different model that I think will make it easier to get children back to school full-time and normally. But we've got to work through these things in order to satisfy ourselves that that is safe and we can build confidence in that model. The advice, and where I haven't heard Stephen McCabe this morning, but where he's right, is that the advice at the moment is 2 metres. And therefore, if that's the scientific advice right now, then that is the contingency that we have to be planning on. But I don't want, for a minute longer than is necessary, or at all if we can avoid it, children to have 2 metres distancing, and for all of the implications of that. Now, I know that for parents, there's no more important issue than the education and the safety of your children. And these are really anxious issues for parents to be dealing with. But we have to work through them carefully, and we have to work through them safely. And that's what we are going to do. And with the well-being, and by well-being I mean education and safety of children, absolutely at the heart of this.
Though, will any of that be in place by August, or is it going to be?
If we can, so that's the question. I can't answer definitively right now, because we're doing that work. But I want, and I said, I think standing here on Monday, and I've said in Parliament, if we have to have blended learning, I don't want that to be there for any longer than is necessary. And it is an if right now, we could get to a point where we don't need it at all, then of course we would prefer that. But we have to work through these things carefully, and that's the process we have to go through. Chris Musson from The Sun.
Hi, First Minister. 13 years ago, you promised to cut primary 1 to 3 class sizes to 18 or under. The latest figures show the average is 23.2, and hundreds of P1 to 3 classes have 30 or more pupils. So how much do you regret breaking this promise now, given if class sizes were small, but obviously more children could return in August for a greater amount of time?
Look, we have taken decisions, we have explained those decisions along the way on education and a whole host of other things, and I take all of these things really seriously, and I don't, this answer is not meant to be glib, but 13 years includes a lot of election victories where the Scottish people have assessed the decisions that the Scottish Government has taken and come to a view on whether they think we're doing the right things or the wrong things. So we will continue to take a whole host of decisions in the round, and we have made a number of improvements in education, from the state of school buildings to some very, very large classes in some circumstances that we've reduced. We've had a recession and a financial crash along the way. So we will continue to implement the things that we commit to in manifestos. Where we can't do that, we will explain that and the reasons for that and why we might have changed course. And we will, every few years ask the Scottish people to judge us on the round on our record, and that's what we will continue to do. And it won't be too long before there's another opportunity for the Scottish people to do that, of course, in the next elections to Holyrood. Rachel Watson from the Daily Mail.
Thank you, First Minister. Just on schools again, there's still a lot of concerns around blended learning, and not only councils being able to take different approaches, but councils passing that responsibility to schools. And in some areas, I think it's Glasgow Council said that a minimum of 14 hours has been set for in-school learning for secondary schools. Is that enough time for children who are preparing for exams to be in school face-to-face teaching? And are the government actively considering setting a minimum hours for in-class? And what more can be done to make sure that children aren't missing out on education just because of where they live?
So I'm not going to repeat everything I've already said. I don't think it will ever be acceptable, even if there is a period for which it is necessary. I don't think we will ever be happy with a situation where young people are not in school full time, and preferably interacting with each other as normal. But we can't ignore the fact that there is a potentially deadly virus still posing a risk to our population. So we have to work out how, if 2 metres distancing is required, then how that is delivered in schools. And that is the process councils have been working on. And I've made very clear that if that is the model we have to have for any period of time, that has to maximise the amount of time children are actually in school. But I would prefer, if it is possible, if we can persuade both ourselves and parents and young people that it is safe, that we have schools operating in a normal way that allows all children to be back full time and behaving normally. So, as I say, these are the things we are working through right now. But nobody should. Sometimes I've heard media and commentators talking in the last few days as if somehow we think the blended learning model is the ideal and what we're aiming for. None of this in the context of this virus is ideal, but we are having to take decisions to keep people safe. But my objective, as soon as it is possible and safe to do, is to have children in school full time and on a normal basis. And I, cannot be any clearer about that. And that's what I said in Parliament the other day. I and the government will move heaven and earth to achieve. But again, I have to say we must make sure it's safe for children, but also safe for teachers and others who come in and out of schools. Vivian Aitken from The Record.
Question, First Minister. I think there are a lot of dads quite disappointed this weekend that they're not going to get their Father's Day pint in a beer garden. Can I ask why, when the first phase we moved to, we concentrated on outdoors, why is it that beer gardens and the like are not considered safe options in this phase?
So that's a perfectly legitimate question. It's one I think I addressed in Parliament yesterday, but it's a good opportunity to do it again. Let me say two things. First of all, the pubs are not open in England either, including beer gardens, and there's no date being given for the opening of them in England yet either. So Scotland is not somehow an outlier here. The fact that other parts of the UK have still also not given a date for opening beer gardens suggests that there perhaps are real issues at heart here that we're all trying to think through. So that's maybe just one contextual point that maybe people weren't aware of, because obviously shops have opened in England a bit ahead of Scotland, although not too much ahead, because our shops will open again a week on Monday. But that's not the case with pubs and beer gardens. Now, the reason is, and Jason may want to say a little bit more about this, there is some evidence about how this virus transmits that says that in particular circumstances it can be more risky in terms of transmission. And in summary, and I will give you the layperson's explanation of this, Jason can give you the more specialist explanation. In circumstances where you are breathing differently, now that may be in a gym where you're exercising, or it could be and some, I think in America, I think there were outbreaks in choirs where you're singing. And in pubs, even outdoors, that is if you are in a noisy environment, maybe there's music playing and there's lots of people there, and if people are having alcohol, maybe there's more shouting than normal. So that's what some of the risks are. What we've decided to do is just ask our advisors for a little bit more that allows us to understand that and to come to a view as to whether, before we open pubs, even outdoors, because you're right, generally there's a lower risk of transmission outdoors, but even taking that into account, particularly with pubs, if this other evidence means that we might have to take a few more protective steps before we reopen. But I very much hope to see people able to have a pint or as some of us would prefer, a glass of wine or a gin and tonic in a beer garden before too long. But again, it's a bit like every aspect of this discussion. I want to make sure that's safe and we're not taking the risk of having the virus run away with us again so that we have to go backwards. And if a couple more weeks before we have the ability to have a drink in a beer garden means we can keep this virus really suppressed at a very low level and maybe get our schools back much closer to normal in August, I think most people would think that maybe is a good balance to try to strike. Jason.
I think it's fair that risk is not binary. Risk is not yes, no. These decisions are not simplistic. Risk is a continuum. You're right, Vivian, that we know outdoors is better than indoors, but we also know that small groups are better than big groups. We know that families gathering in a garden socially distanced in a controlled way is better than allowing lots of people to meet in a slightly less controlled way. So that's why we're more cautious about that version of outdoors than we are about some other versions of outdoors. I think it will come before indoors, but I think we just need a little bit more time, a little bit more data, and a little bit more advice in order to reassure the First Minister and the Cabinet that we can safely take this step, because there's lots of steps in the route map, and this is one that we're just a little bit more cautious of than some of the ones you've seen us do today. So Father's Day is possible, although it's going to be pouring with rain on Sunday, I understand, so you may need to move it forward a day. But you can do that in a safe environment in a garden with family socially distanced. You can't yet do it in one of these beer gardens or outdoor areas. And I have sympathy for those businesses, and we absolutely want them to open as fast as we can.
And we will get them open, absolutely, as soon as is possible. Kieran Andrews, The Times.
Thanks very much, First Minister. Back at the start of May, in the Framework for Decision Making, the Scottish Government published modelling on the impact of schools returning. I just wondered what modelling has been done since then and what it's told you about the options for returning schools under various circumstances.
I know the graph in particular you were talking about, which I think we based at the time on what had happened in Denmark, if I'm remembering correctly there. I will have to check what further iterations of that we have done, and I'll come back to you on that once I've had an opportunity to check. But we, on an ongoing basis, we model, before we make any changes, we ask our modellers, our statisticians, our expert advisors what the estimated impact of any change would be on the R number, on numbers of cases, prevalence and incidence. Tom Peterkin, Press and Journal.
Good afternoon, First Minister. I wonder if you could give us an update on what the latest is regarding antibody testing. What are the plans for that in Scotland, and what role you see for antibody tests in terms of combating the virus?
I'll hand over to Jason pretty quickly, but we in Summary have been doing sample antibody testing because of the fact that the tests for individual antibody testing are not quite where we need them to be, but we're keen to do more antibody testing as soon as we can. So I will hand over to Jason to update us.
So it's one of the dramatic scientific changes in the last 6 weeks or so. I remember standing at this podium and saying antibody testing, treatment and vaccine would be game changers in this pandemic, and we now have some reliable antibody tests, and this week we've had some reliable treatment, only for those who are very, very seriously ill, it's important to state. Antibody testing is now getting much more reliable, and in Scotland we're using it for two purposes. We're using it for research to understand the virus, I'm using it for surveillance, to be able to answer some of those questions that you've just asked the First Minister about numbers in the population. The problem here, and the problem globally, is we don't know what it means. We don't know what a positive antibody test means. So we know it registers your immunity, in inverted commas, but we do not know, because we've only had the virus for 5 months, whether that lasts, and, importantly, whether, even though you don't get the disease twice, for example, could you still pass it on to others? That science is unknown. There are multiple research projects around the world working on those two things. Where you might see in the newspapers about immunity passports. No country in the world is doing reliable immunity passports because the science doesn't allow us. There is a world in which, in the future, that may well be something that we would consider. If you got medium to long-term immunity, then we would be able to tell people to do that. But just now, the science is not there.
Thanks, Jason. Derek Keeley from the Courier.
Thank you, First Minister. One of your own MSPs, Alex Neil, has today described any plans to have part-time face-to-face learning as absolutely unacceptable and called on councils to commandeer public buildings to help expand the school estate and make it easier to get more pupils into classrooms. I know that's not been part of the kind of current planning, but is that something you've ruled out?
Well, what I have said is if there is to be a blended learning model, we want to maximise the amount of time children spend in school. So we would expect councils to look at all of their resources and all of their assets and all of their physical buildings. And that's part of the work that has been done just now. But without repeating myself again, we don't want, if it's possible, to have an alternative, to have a blended learning model for at all or any longer than is necessary. So we're also looking at how do we create the conditions, which is part of making sure we keep the virus suppressed, and then have other possible measures in place to allow schools to get back on a normal basis. So I think I've run through that a few times already today, so in the interest of time I won't repeat it, but both of those things are important strands of work that are underway right now so that we can continue to work towards the objective of getting children back normally as quickly as possible. Simon Johnson from The Telegraph.
Hi, First Minister. I just wanted to ask how confident you are about winning over the support of teaching unions if you were to choose to reduce the social distancing limit, because they have expressed concerns about that. And on the economy, the Welsh First Minister has just announced that all shops are reopening in Wales on Monday. So I was just wondering, why is it safe to go shopping next week in Cardiff, London or Belfast, but not Edinburgh?
Well, on that last point, we have to make decisions based on our own circumstances. Mark in Wales is doing that. There are things I haven't heard all of Mark's announcement today, but I spoke to him just a couple of days ago, and I don't think, for example, Wales have done some of the things we've done. I don't think Wales have yet done the extended household model. I think Wales may be on a slightly slower trajectory than Scotland is on reopening tourism, for example. So we will take slightly different decisions, but on retail, it's a week difference. And I think that's, we are taking slightly different decisions based on our own circumstances. We're all trying to keep the virus suppressed, but sometimes I think we can overstate what the differences are. So on retail, Scotland's shops will open a couple of weeks after England's and a week after Wales. Pubs, neither in Scotland, England or Wales has a date been given for pubs reopening. I hope in Scotland that will be soon. Schools in Scotland will come back in August. In England, the majority of young people will not be back in schools into September. Northern Ireland, it will be later in August. So we're taking these decisions with schools, of course, that reflects partly our different school terms. But we're taking these decisions based on what we think the right mix and the right order and the right pace is. And what I'd say to people is what we're doing in Scotland right now is working because we're seeing the virus really, really decline and be in retreat. We're seeing numbers in hospital reduce, numbers in ICU reduce, and numbers of death reduce. So what we're doing is working. And therefore that says to me, let's stick with this and get this virus hammered down to the lowest possible level so that we can then, as we come out of lockdown, make sure that that involves much more normality than would be the case. David Ball from the Herald.
Thank you, First Minister. Given that different councils will be offering different levels of face-to-face teaching, going on the money they have available to provide it. Are you concerned at all that next year's exams, if they do go ahead, will be a level playing field for students, if they do go ahead, obviously, and particularly for pupils who are looking at going on to further education?
Well, I know you all do listen very carefully to what I say, but I'm going to ask you, I'm going to appeal to you to listen to what I'm about to say. I think for probably the third or fourth time in the course of the last 40 minutes or so. 2 metres right now is the scientific advice we have for physical distancing, including in school. So we have to work with councils to see how will that operate, and that's where the blended learning model comes from. But within that, we want to see if that is what it turns out to be necessary, and for however long that is necessary, we want to maximise the amount of time children have in school. And we are working with councils to do that, and we've said if that involves additional resources, then the Scottish Government will certainly be willing to have that conversation as well. And it is, well, I'll come back to the exams in a moment, but we want to also try to see if the conditions can be created in Scotland for not having to have a model of blended learning, but of having children back in school normally. But the reason we need to work through that is because part of that will involve making sure the virus is still under control, and then how we have that different model. And that's what the Scottish Government is doing right now, and I hope that is a model that we can see develop. But we want children to be back in school normally. And on exams, I said this I think on Monday very firmly, the intention is the exam diet goes ahead next year. And the Deputy First Minister has made that clear. But my final point is this one, and it's the point that I suppose is the most frustrating one for me, to be perfectly honest. There's two things I wish more than anything I had right now, and wish I'd had for the duration of this. One, of course, is a magic wand so that I can make all these problems that this pandemic creates go away. I don't have a magic wand. I just have to work really hard to get us through this as best we can. But the second thing that would be really helpful for me to have right now is a crystal ball, so that I can look ahead to August the 11th, or further into the autumn and winter, and know exactly what the levels of this virus are going to be, because that would make planning much easier. But I don't have a crystal ball either, and viruses, unfortunately, don't behave in the way we would all like them to behave. So we have to plan for what we assess and what we estimate and what we hope will be the case, and those plans have to be flexible because of the nature of what we are dealing with. But the one thing I do know, and the one thing I know with as close to certainty as I can know anything in dealing with a pandemic of a virus, is that if we all keep doing the right things, we will suppress this virus, and we will make it much easier for ourselves to deal in a targeted way with any flare-ups and outbreaks and sporadic clusters that we might face in the future. So that's what we've got to keep focused on. And if we continue to succeed there, then all sorts of other things, whether it's schools back as normal or not having to have 2 metres in pubs and restaurants, all of that becomes much more possible, because we're not dealing with a virus that is circulating in the community at very, very high levels. So your risk as an individual of coming into contact with somebody with it is much lower. So all of these discussions come back to this central point. We've got to keep suppressing this virus and get it to the lowest possible levels, so that we can't, it's not just that we're coming out of lockdown, but we're coming out of lockdown with as much normality restored to our lives as possible. So that's why I keep asking people to keep doing the right things. And I'll repeat, lastly, something I said earlier on. These last 3 months have been, really dreadful for all of us, and dreadful in particular for those who've lost loved ones, dreadful for those who've had to live under lockdown. But while I know there's still a long way to go, and I know that anxieties are increasing for businesses, for parents, in terms of the virus itself, I've never been more optimistic than I am now. That we can actually beat this thing and get back to something that is very close to normal. But we have to keep doing what we are doing in order to get there, or the risk is we go backwards, and I don't want to have to do that. And lastly, Andrew Learmonth from the National.
Hi. Can I go back to Professor Leitch's concerns about shoppers in England sort of massing? Can you say exactly what it was that concerned you about that? And is there anything the Scottish Government can do to make sure that's not repeated here when the shops open up on the 29th? Will you provide guidance on how to shop carefully and safely for shoppers. And if I may, if I can ask Fiona Hyslop with her other hat on, there was a meeting yesterday between Scotland's theatres and a number of arts freelancers. There are a number of questions about the route map. One question they asked was about, when can we expect theatres to reopen? Are you able to give a little bit more detail about when you think that might happen?
Okay, I'll ask Jason to take the question for him first of all.
Yeah, so what concerned me was that what appeared to be a reliance on face coverings to make you invincible. Face coverings are an important element of risk reduction, but they do not make you invincible. So it was just in news broadcasts. It looked as though people were not queued up outside shops, but they were gathering in groups around the door of the shop waiting for it to open. A bit like Boxing Day sales almost as the shops opened. I have great faith in Scotland's retail industry, and they have behaved impeccably to this point. Supermarkets have learned a whole new way of managing crowds, of distancing, and individuals have behaved, as far as I can tell, very well. Now we need to extend that to smaller shops. I already see some shops around where I live getting ready for exactly that. That needs businesses to have guidance, and we've done that and will continue to give them guidance. And it needs the population, the customers, to behave. So if it's one person at a time because the shop is small, then it should only be one person at a time. Face coverings in crowded areas, absolutely. But they do not mean that you can then not physically distance. That's not the purpose. The purpose is where it's difficult to physically distance, wear a face covering, and definitely wear them in public transport. But they don't reduce the need for the other public health measures. That's what made me a little bit nervous.
Yes, I met with the Federation of Scottish Theatres just recently. Obviously, it's a real challenge for theatres and indeed other events that are in phase 4. And as you've heard, we're still learning more about the virus and how it circulates. So it would be very, very difficult to give any certainty at this stage as to when that might be. But of course, as we know, theatres have to plan their productions way in advance. So we are in active discussions as to what type of support they would need, particularly either for institutions. But as you pointed out, there are so many freelancers work in our theatres. We need to think about how we can support them. Now, we moved extremely quickly to set up with Creative Scotland the bridging bursary for freelancers in the creative sector, but very conscious for those sectors that the opening and how they might open is some way away. There's a lot of planning has to go in, but it's something that I am taking a very seriously active involvement with. I've also asked to meet with the UK Culture Secretary to understand some of their work and indeed to identify if there's resources that we could collectively use to make sure that our culture and our theatres can return with the vibrancy that we know Scotland's theatrical sector has.
Okay, thank you very much, Fiona. That concludes the questions for today. My thanks to the journalists, my thanks to Rachel, our BSL interpreter, to Fiona and to Jason, and my thanks to all of you for joining us. I'm going to end, and this is going to be a test of my memory, so Jason can jump in and help me if I forget any of this, but I'm going to leave you with some facts, because these are the things we need you to do to make sure you stay safe, you protect others, and we all save lives. So F, face coverings in enclosed spaces like public transport and shops. A, avoid crowds. C, clean your hands and surfaces. T, 2 metres distant. And S, self-isolate and get tested if you have symptoms. If all of us follow these rules and stick with these guidelines and remember these facts, then we will keep, even as we all go out and about a bit more, we will keep suppressing this virus, which is vital in order for us to take more steps further in the near future, as I very much hope we will do. So thank you very much indeed. Just can I advise you that as we go into phase 2, as we have now gone into phase 2, we will no longer be doing a Sunday media update, so there will be no update on Sunday. I will be back here with you on Monday at 12:30 with Benny Higgins to talk about the report of the advisory group on economic recovery. In the meantime, have a good weekend as far as possible within these circumstances, and to dads out there, happy Father's Day.